Then we gave some food to the baby via a finger feed, and now she's actually has a little bit of energy on board and she's giving it more effort at the breast. There, you heard the swallow. Mom's gonna massage to help transfer. It's normal for baby to pause, catch their breath. There's a swallow. And then she's only 2 days old, so they will do more sucks per swallow, but I'm still looking for more. So I wouldn't say this is a great feed transfer, but at least she's on and actively sucking. Her eyes are open, which is a good sign. Mom's going to continue to massage to try to encourage more milk flow. Take some of the work off of her because, again, she does have a limited motion with her tongue that needs to be released by a preferred provider. And sometimes I will have moms take their hands from farther back here and do a compression. See if we can increase in there. More swallows. And you release when she pauses. And you compress when she sucks. Can be deceiving if baby's at the breast, moving the mouth but not hearing any swallows. You should hear some audible swallow. That was a swallow. That was a swallow. Another swallow. So this is now baby's transferring. Good job. That's what we're looking for. So now you have a comparison before and after.